cool joining us on Cool, 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 the podcast that explores intersections of inspiring technology, fascinating people, captivating stories, or hopefully a combination of all three. So get ready to embrace your inner cool kid as we go behind the scenes with today's innovators, storytellers. I'm your host, Cameron Kitt, founder and CEO of Yo-Yo's, which stands for You Own Your Own Stories. And today we have the privilege of chatting with Dipu Patel, the awesome Vice Chair for Innovation and a professor at the University of Pittsburgh, as well as president of PAEA. Welcome, Dipu.
Thank you, Cameron. It's a pleasure to be here.
What is PAEA?
It's the Physician Assistant Education Association.
Yes, I remember I had recommended you guys call yourself paella, but I don't think it's going to fly. Because then you get to eat paella, and how cute would that be?
I was going to say, I like paella, so I have no problem.
We all like paella. Oh, yeah, so you're only slightly busy right now.
Just slightly.
Okay. Yeah, I wonder what, we can talk more about that role and what your work does, but I really wanted to start off, since this is a podcast about storytelling, if you could just tell me about a really impactful moment or interaction you've had with a patient that comes to mind for you.
Yeah, I think I will reach into the depths of my early years when I was still in training in the South Bronx and I was still in school. I was in my second year. I was doing, I think it was my internal medicine rotation, and it was 1999. So I'm dating myself a little bit. And that was in the days when we actually had HIV floors, where HIV was quite endemic in in the area that I was practicing in, and a really impactful story that changed how I thought about patient care and inclusivity in care was a young man. He was in his 20s, had been admitted to the hospital, and myself was, I think, 22 at that time, 23 myself, and had been admitted to the hospital, and he was admitted because he had HIV/AIDS. And back then, we only had one drug that we could give, and this particular patient had a number of opportunistic infections that he was fighting, and was in isolation. So we had to. The analogy that I can give that will be applicable to people's memories in current times is remember the early days of COVID and then some. So, PPE, and you're really double masking and double gloving, and every time you go into the room with a patient, because there were several opportunistic infections. But it wasn't the infections themselves that actually made an impact on me. It was the fact that this young man was not allowed to have family. His family actually had his family had abandoned him because he had come out as gay. But his adopted family, the friends and other members that he had become friends with throughout his lifetime, were not allowed to see him in his last few days and hours of his life. And I had gone in to do a daily physical exam on him and kind of double check vent settings and things like that. And actually, he was awake, but not fully with it. And he reached out to hold my hand as I was auscultating his heart and lungs. And it was in that moment that I was able to truly understand what humanity felt like, because I was probably the only human being who was going to touch him that day. I was probably the only human being who was going to interact with him that day. Mm-hmm. And he was really shunned from society for something that he had no control over. And in the moments of when you had to show your best cases and best aspects of humanity, we were not giving him that dignity that he needed in his last few moments. And it was at that I realized, that this sort of care is not only were we not treating him well, but we were not doing ourselves any justice by not allowing him to have the dignity of a good death. And so that moment has stayed with me, and I've often shared this experience and this particular story with my students throughout the years, because It really has. I've seen thousands of patients in my career in the 25 years I've been practicing. That one stays with me every single time. And it's really changed how I look at patient care,
Mm,
especially those who are not able to speak for themselves and not able to advocate for themselves.
wow. It's because he reached out to hold your hand and it kind of stopped you in your tracks.
That's right. That's right. And how much more human can you get in that moment,
Yeah.
right?
There's a lot of studies on how much we need touch. I
Absolutely.
remember reading the like I like telling my friends about the hug index of like I think it's something like you need 3 to 4 for like absolute baseline, 4 like 5 to 10 for maintenance, and like 10 plus for for like success.
I
And all
love
my friends
that.
are
I
always
have not
shocked
heard
by.
that.
Yeah, I don't know if I'm actually right or how close I am, but I remember thinking like there's a minimum number of hugs that a human being needs a day to like
That's
be
right.
survival. And you don't think about that, and we didn't think about that till COVID. I mean, that's just such a powerful story, Deepu. Thank you for sharing, and it's like clear that you still care so much, and this was, you know,
And
20.
it is part of the thing that I'm a big advocate for technology, and that's part of who I am and kind of what I do.
Mm-hmm.
But that story really grounds me, and it's the reason I say we need technology, but we need it with a human touch. It will always that moment, that those sorts of moments, and I'm not alone in having experienced something like that. I'm sure of it. But that is the aspect of what care truly means when we say healthcare. And it doesn't matter how many pieces of technology you add to that interaction or to help them, it's the touch that you remember.
Mm. It's my so my boyfriend is Puerto Rican. His family is like from New York. They're like New Yorkers,
Uh-huh.
and his like lifelong Brooklynites. And his dad had a situation where it was that tragic COVID experience where his mom
Right.
was in the hospital and no one was able to see her.
That's
And he
right.
still talks about how he wasn't able to get that hug. We talk about it. Like he's like, he's like not really even able to process and move on from her death because he's like, I never got that hug. And I think about that, like, yeah, that I mean, that's one of the one of major tragedies of COVID was like the deprivation of the touch. But I also think there's something really thematic about, yeah, like the human touch. We talk about human touch, like you mean physical, like being there and like
Physical.
really connecting with someone. And I
Yeah.
think there's a lot that's asked of clinicians and healthcare providers to do. And then on top of that, it's like, and remember to care.
Exactly. Oh, by the
Remember they're
way.
a person. And I mean, I've heard of trainings where they're like, before you go into the room, like think that this could be your family member. I
Right.
mean, I don't know how hard that it gets because I assume there has to be some level of disassociation to protect yourself, right? So how do you balance really being there and like really seeing this from the person, like from this being, this could be my brother, this could be my mom, this could be my great grandmother, right? Like without letting it all the way in. I
Yeah.
don't know what,
Yeah.
I don't know what it's like. Yeah.
Yeah,
Tell me
I
more.
mean, I completely agree with you. And I think part of this is learning how to compartmentalize what you are doing for work versus what you are doing in your personal life. Oftentimes, and I think COVID really showed all of us as a society how much healthcare providers bring their work home, whether it is consciously or unconsciously, and how much
Mm,
we really do have to learn how to compartmentalize what we have seen that day in the hospital, in the clinic, how many conversations around death or dying or giving bad news or giving good news, whatever it may
yeah.
be that you've had, and
Yeah.
to say, oh, okay, great, now let's go to soccer practice, right? Like
Yeah.
we're just
And
gonna
then
move on
shut it
to
all
yeah,
down.
exactly.
Yeah, I
Um,
had to tell 2 family members that their loved one wasn't gonna make it, but let's
right.
go, yeah, let's go drop off our kids for soccer
Yeah,
practice.
let's
I
go
don't
to
know what
dinner,
that's like.
Yeah, let's go celebrate our, whatever, birthday and. But and I think that's part of the reason why learning how to care comes naturally to us and everything else is kind of
Mm,
layered on as
mm,
human beings. So
hmm,
one of the things that I would when I teach students, I tell them don't forget to smile, don't forget to bring your whole self to the patient encounter that you have, but also know that you can't get too involved because that will stop you from making decisions that are objective for the patient in front of you, and so that you are not bringing your biases into the encounter. And that's a really hard
mm.
fine that's a fine line and a hard balance to reach
Yeah,
20, 30, 40 times a day. My first job After I
Yeah.
had graduated, I would see 40 patients and 40 patients in a 12-hour shift in an ER. And that's 40 unique patient interactions with unique personalities, with unique problems.
Who
And
aren't
I
like
can't,
in their best moment
and
because
not
they're
in
in
their best,
the ER.
exactly, right, not in their best moments, and forget what is happening in my personal life, right? I can't
Mm-hmm.
bring any of that. And then I
Mm-hmm.
have to walk in and say, how can I help you, and not bring the
Yeah.
bias of the 3 patients I saw before this
Yeah.
person to this particular
Yeah.
encounter. It's a
And then,
really difficult thing and a skill set to learn. And that's the part where it's like, above all, I think healthcare practitioners are humans, and you have to bring the best of humanity, and the worst of humanity is standing in front of you.
mm,
And it's really, really hard. So you can teach the other skills, right? How to auscultate, how to find a murmur, how to treat a wound, how to, order labs or whatever. All those things are teachable. It's the human aspects of caring that are not teachable, that are innate in us. We just need to learn how to not be afraid to bring them to the surface with the patients that we see and care for.
oh, Deepa, there's so much I want to talk about. We just don't have enough time. Like, I just want to go back to that very first conversation of the man with HIV. I remember reading about Princess Diana, and like she kept getting in trouble for saying things like, "You can give someone with HIV a hug and they need it." I remember reading about that, and like she was like, but like, and of course the royal family was like, "No,
No. Right.
don't talk about that." But I think like yeah, what you describe is so powerful. I just want to come back to technology for a minute. What you mentioned is that you're a big proponent for technology.
Absolutely.
You teach the next level of healthcare. You've been of healthcare caregivers,
Yeah.
clinicians.
Yeah.
And so this film is called film. This podcast is about cool tech and cool stories, right? My work is about bringing the human into the technology, or telling the human story of the technology most of the time, right? How do we connect with the patient? How do we connect with that real person story? So let's talk about. You mentioned the like always keeping the human touch. Can you give me one example of a use of technology that enables or contains or retains the human touch, and maybe an example of technology in healthcare that removes it, that you've seen like hurt that
Oh,
experience?
all right. Give me a minute. I'm gonna have to think about. Um, I think there's a balance that we have to reach. So, in terms of a piece of technology that improves the physical touch, is the stethoscope. And I think
Hmm.
it's so ubiquitous. And I know it's like you want to think it's something like AI or something
No.
really sexy, but really, I think I went. The stethoscope is the thing that comes to mind because as a patient, when someone walks into a room to say, "Hi, I am so and so, and I'll be taking care of you today," one of the signature things that patients always notice is, do you have a stethoscope around your neck or in your pocket? And it
Oh.
is so synonymous with care that I think that piece of technology really does allow us to not only touch the patient with the tool that we're using, but also hear them, both literally and figuratively, hear their heartbeat and their lung sounds and really understand them. And so it's touch with technology. Now,
Huh.
one of the newer things that's happening with the stethoscope, as core as it is to the care that we provide, is the stethoscope is being digitized and it's being infused with current technology, all the aspects that our smartphones currently have, and then with AI. And so it is a really re envisioning of how this tool that has changed how we practice and has become ubiquitous in terms of identifying us with care, and how are we leveraging it for the next generation to provide better, more intimate care. And so, as stethoscopes become more digitized, what we're going to see is that everyone at home is going to have a stethoscope in your first aid kit. So think about your first aid kit pre-COVID. You probably had a thermometer, a couple of band-aids, some antibiotic ointment and whatnot. I would venture to guess that most people now have after COVID an O2 monitor, or are at least know how to do it, how to check their oxygen saturation using their phone, which you can do now, right? And this is because of COVID. And so fast forward to 10, 15 years from now, as the stethoscope becomes digitized, what's missing from that patient interaction is that if I am seeing you as a patient, Cameron, and you have a digital stethoscope at home, like if you had the traditional one, obviously I can't listen to you because we're on screen to screen, right? Um, but you could have a digital stethoscope at home in your kit, and you would put it on your chest where I would instruct you to put it. It would record the sound and then upload it to your EMR, at which point I would be able to listen to it. So, what we're doing with technology now is designing for distance, but communicating for closeness. And we're able to
Ooh.
bridge that gap with technology, but through the guidance of a human being. And
Oh, I
that's
love
one
that.
example.
Because like some of those situations could help you avoid an appointment,
That's
right?
right. That's right. Right.
And while I really want to see my doctor a lot of times. If I can't avoid the appointment, that'd be really helpful. It reminds me of I was talking to a guy from Zimmer Biomet. They make knee joint replacement, like
Yeah.
replacement knees. I don't know what those are
The
called.
joints. Yeah.
Yeah, and the new one that Zimmer has come out with has all the tracking technology in it, like how much heat, how many steps. And I was like, oh, so it's going to tattle on you to your doctor about
Yes.
like how much you've been doing? He said, no, it's going to help you avoid the check-in appointment, whether you need it or not. And I was like, oh, I mean,
Right.
yes, designed for closeness. So I know from the clinician's perspective, it'd be really nice to free up your schedule. But yeah, I mean,
Yeah.
so like there's like this movement, right? My sister's obsessed with her Whoop and like sleep and measuring everything, right? She has one of those altimeters, or I can't remember what it's called, that like, she like likes to measure everything. There's
Yeah.
a lot of movement for that. So yeah, like sounds like it designed for closeness. It's interesting. So it does limit how much we touch each other, I guess. But is it a
Absolutely.
benefit overall?
It can be, and it depends on the situation. And I think this is where I think a lot of people get in trouble because they say, "Oh, great, we have this wonderful solution. Let's apply it to everything." And that's
Mm-hmm.
not how it works. Humans are not designed to one size fits all anything. I don't even take my coffee the same way on any given day.
That's a good point.
So it's kind of like, yes, we're going to have these tools, but they're going to have the time and place and situations in which we will want to use them and leverage them. But then other times, you're going to say, no, I really need you to come into the hospital or to the clinic and be seen. What it is going to do is kind of lower the burden of the office visit, right?
Hmm.
One of the other examples that I give students or when I lecture is, if you think back to the 1800s or 1700s, before hospitals existed, before a hospital system was a thing, um, doctors came to your house if you were sick.
Yeah.
Right? They would just come
The
and
family
take care of
doctor.
the family. Yeah, exactly. They would come and then they would say, "Okay, do this," and then I'll see you in a day or two, and you would do that. And when hospitals became a thing, right, then the patients went to the doctor. So
Yeah.
it kind of reversed for us. Now, I think technology is going to bring us full circle where now we're going to have a hybrid or a
Hmm.
return to the doctor is going to come to but it'll come to your home, but through a screen,
Yeah. And save
right?
everyone, which is kind of
Yeah,
getting us back to kind of how it was more personal. And there's all this like direct
exactly.
care, and there's services where you can like pay to just have one doctor, almost like the family doctor now. But yeah,
Right.
you're right, through a screen, yes. There's not there, you can't get everything you need, but I
I
like
was about
hearing
to
about that.
say
Yeah.
it's a hybrid model because it won't be everything, right? But do
Yeah.
you really need to drive an hour, look for parking, pay for parking, wait in the waiting room where you're potentially exposed to other infectious diseases
Yeah.
for your diabetes check?
No.
That we can do at home. You
Or
can,
your dermatology follow-up of
right,
how the cream is doing. I guess, well, sometimes there's stuff that's needed, but yeah, like your dermatology check, things that are could be avoided, and also saving time for everyone, right?
same time.
There's also an economic element.
Economic,
Deep.
and by the way, climate change. We don't need
Mm,
to drive an hour. I mean, most of us, I live in a city, so it's not that much of a drive, and I also have access to public transportation. But if you think about a
mhm.
large swath of our population has to drive quite a bit to get anywhere forget a doctor's appointment, but even a grocery store or whatever. And so the impact on climate can also be huge.
Hadn't even thought of that. I'm also, it also made me think about our elderly population who spends
Yeah,
a lot of time going to appointments,
right,
right? It's like just a huge burden to get access, to get the ride, right? And a lot of
right.
times there are issues with access. When speaking about diabetes, I remember reading about a hospital where there was a huge number of amputations and they couldn't figure out why they were doing it so badly, and then they just ended up creating a free ride service so people could come in to get their, insulin. It's like, turns out it was a population health issue, right? It was just
Wow.
getting a ride. So if we can stop, yeah, if we stop needing the rides, then you have to teach grandma how to use the iPad. That's a whole other conversation, right?
That's a
Or
whole other conversation. I'm
that's a
not going to
whole other,
say,
but this
I will,
generation,
I will say that generation is definitely more willing to learn because they've had nothing except learn how to be adaptable in
Mhm.
situations when they had no other choice. That particular generation. I know everyone kind of harps on like boomers and older generation, but I actually I would say that they are more willing to learn. We have to be a little bit more patient with them and teach them how to leverage this technology.
You're so right. Well, I just want to take a quick moment to remind everyone listening that this podcast is brought to you by Yo-Yo's You Own Your Own Stories, a documentary storytelling company that demystifies cutting-edge technology with emotional human stories. If you've got a cool story to share, we can help you get it out there. So, speaking of cool stories, tell me about this book behind you, Digital Health.
Yes. This is a book I published last year, November of 2023. It was a passion project that was brought to life by several, I would say, 40, 50 authors. And it's a book called Digital Health, Telemedicine and Beyond. So we talked about some of the ways we're leveraging technology, but the book has 37 chapters of how technology is bridging the gap of care and making care more accessible through the use of various technology, including wearables, like you had mentioned with your sister,
Mm-hmm.
including the glucometers, the digital remote monitors, the remote patient monitoring, AI and machine learning, and how we are moving forward into leveraging these technologies that have been around for a while. We're just in healthcare now starting to see how they're being applied and leveraged so that we can improve access to care, improve outcomes, improve quality of care.
That's so cool. So you gathered a bunch of stories.
Well, they're not stories per se. They're actually it's a little bit more technical, so you can certainly
Just like,
use it as a textbook. But there are
okay.
case studies in the chapters.
So
Yes,
it's more covering the different kinds of technology that are enabling this hybrid
that's
care
right.
that you've talked about.
That's right. It
Cool.
covers the whole gamut. We start with the basics, where we're going, all the way through how organizations can vet
Hmm.
certain vendors and products to leverage them in there.
It's actually one of the things I heard that was like the one of a secret blessing of COVID is that it forced a lot of health systems to digitize way faster. Would speak
It
to that.
did. Yeah, it absolutely did. And I think that's probably the one silver lining I will say. Telemedicine became, it wasn't that it wasn't there before, it was nobody was using it and adopting it and thinking that it was a good way of providing care. And COVID basically opened the floodgates in this space. And I think for the better, it has allowed us to experiment. We're not perfect, but I think it's allowed us to do some research and find the best practices as we move forward.
I'm thinking about my psychiatrist. Do you know how much psychiatry and like therapy were not therapy? Yeah, just psychiatry in general,
Mhm.
like the diagnosis of mental health, and then like I think about how much was that digitized beforehand? Because whenever I have a psychiatrist, I mean, the digital health, they've got it so down. Like it's
That's
so
right.
down pat. But I get to talk to her who's in Texas
Right.
from her home. She had mentioned to me that sometimes she has patients who are very angry, and I was like, oh, I wonder if it improves safety, like for her,
It
if
probably
you're not
did. Yeah. And we've
interfacing.
seen the highest uptick in behavioral health and mental health services when it comes
Mm.
to telemedicine. And I think it's here to stay. In fact, I've been following the extensions that we've had through CMS, from the public health emergency being extended. Now we're 4 or 5 years into the extensions, and they always carve out an exception for behavioral health services because it's so needed. It's also the access is still a problem with behavioral health services. Don't get me wrong; there's still a long wait time, but we all can remember what it was before, where we were looking at 8, 9, 10 month wait times for someone who you may get along with, you may not, may be the right fit, may not be the right fit. And now it opens up the entire nation for us in terms of
Yeah.
access. And that
Yeah.
has made a huge difference. It's made a huge
Yeah.
diagnoses have gone up, but I think that's also because access has gone up and we're now able to track that data.
Yeah, that's so beautifully said. So Deepu, you've done so much, you know so much about this space. You have personal experience, tons and tons of personal experience. You work with patient, like you work with students, and you also are with PAEA, you're interfacing with like the whole nation, and you're looking about technology. What would you say is your biggest, maybe most outlandish prediction if if we're looking at the crystal ball for the future of patient care? Maybe something that most people might be surprised by.
I think I have to measure myself here because I think there's a lot of wonderful things that we could see. I do think that in the next 2 decades, if not shorter, we all will have a digital companion with us who will help us, coach us, guide us, take care of us. What that looks like, I don't know, right? I don't know if it'll be in a robot form or some sort of a screen or, what form that digital companion will look like. But I think that's where we're headed.
That is so interesting, right? Because I think I go to meetups for AI and we talk about AI agents and agentic
Mm-hmm.
AI. It really scares me, right? Because I've talked
Yeah.
to people who run agentic AI companies where they're like, I don't even know what my agents are doing anymore. And I'm just like, ah, ah. However, I want someone to, I do want, just talking about agents, not from healthcare, just from the
Right.
agentic side of, I would love for a program to reschedule my appointments. That would just alone,
Yeah.
so there's the healthcare companion is a really interesting concept. Like, can you give me an example of how you think it might come into play?
Yeah, sure. So imagine imagine you're in need for, let's say, your routine preventive services, right? You're due for your shingles vaccine, you're due for a mammogram, you're due for
Mm-hmm.
a colonoscopy. And so to go along the lines of agentic AI, it's going to look forward and just say, okay, you don't have any appointments on these 2 days. I'm going to call your a doctor, your GI surgeon, and schedule your colonoscopy, and it'll be done for you. I'll order the prep. It'll arrive 2 days before you're ready to take your prep. I mean, the whole shebang, right? It was basically no to preventive care will not be an option
Oh, that's
because
so smart. Because no one wants to
because
get their
nobody wants
colonoscopy.
to get their colon. Exactly. How many excuses have we heard for a colonoscopy, right? Or a mammogram. Oh, well, I need to reschedule. I'm sorry. I got to meet this friend for coffee. No, the mammogram is important. And so, I think that
Wow.
accountability from a digital companion is a little bit different because guess what? That companion, and I will say it will have that humanistic component to it. I'm going to say it
Hmm.
because we don't know. I guess you'll get
The
to
program,
decide.
the
Yeah, you'll get to
algorithm.
decide what you want to name it, so you can give it whatever
Yeah.
gender you want. But I think it will take away the burden of you scheduling so many things that are important for your care. I also think about it. I have a nephew. He's under 6 months old. All the stressors that go along with being a new parent, vaccine schedules and whatnot, all of that will be taken care of because you as a parent will feel a little bit lighter in terms of scheduling all of that out because the first 3 years of a child's life you're getting a ton of vaccines and you want to make sure that
Yeah.
you're on schedule and you're protected and yeah, so there's so many aspects. Or even you know grandma had chemotherapy today, let me check in on her, and the digital companion will send an alert out to everybody in the family, she had blah 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 and this is how she's doing and this is when she's due for her next
Oh
scan.
my gosh, so she doesn't have to do like a full
She doesn't.
blog to keep the whole
Right.
family updated, which is another big part of cancer care.
Right.
Is like suddenly you're a
Think
journalist
about
keeping a full.
That's
Yeah,
right. And I mean, and think about, because we all live in different parts of the world and different parts of the country, we're not always there to care personally, right? And so this companion will be there to help take care of grandma or whoever it may be,
absolutely.
but keep you in the loop so that as a
Yeah.
caregiver you know what's going on with the care.
I think that's just so interesting. It's funny that both of them are about scheduling, but I think if you could imagine that implemented, I put everything on my Google Calendar. I'm like my entire life
Yeah.
is there, so it would be very easy for an agent to plug in and be like, "Oh, you're free," and I've scheduled it, and I would love that. But imagine how many more colon cancers could be avoided, and breast
That's
cancers
right.
could be avoided if you, because I just did a film about a woman who had stage one and she had caught it, like the mammogram caught it at exactly the right moment, and then
Right.
boom, it, like got, she did have to do a mastectomy and all that, but like she was there, she was just like, get your mammograms, right? So like if we could
Right.
have that preventative care baked into the population, we'd have a lot less cancer, I imagine,
Yeah.
or
I
less
also
serious cancer.
just yesterday I posted on my LinkedIn from someone in my network. Um, they were using, so our AEDs that are all over, um, wherever we end up going, because there's AEDs everywhere now. There's a new concept that's being developed where the AEDs come with VR glasses that you put on.
Mhm.
So if you see
Mhm.
someone pass out, you open the AED, you take the glasses, you put them on, and it automatically detects the patient. It detects and it walks you through um, where to put the pads, what's going on, what order to do it in. And it automatically calls 911. So say if you're alone, it
Oh my
saves that
gosh,
and by the way, the
that's
second
so cool.
you put them on, it's already collecting the data. So it knows exactly what time the patient went down. It knows exactly how many compression cycles you did and is able to transmit that to the medics and then to the ER so that you know exactly, because right now the way it works is, oh, I started it, somebody note the time if you remember the time that you started and you're in the moment. That's, if you're a layperson, that's the last thing you're thinking of, like what time did I start compressions and how many did I do? But it does all of that for you. And so when the medics arrive, it's just giving a report. The medics get the glasses and says, okay, there were 3 cycles of compression done, this many shocks delivered, and this is what it took to get him back to normal sinus, or this is where we are
Oh my
in
gosh.
the emergency protocol.
And they're
So
just glasses.
they're just
I'm
glasses.
watching it. This is so cool. And just for anyone listening, I'm gonna put Deepu's um, LinkedIn in there, and you might need to go back a little ways since this will be posted in a few more weeks. But this is like, this is exactly. I actually did an interview with an EMT who talked about like just the sheer number of times that if there had just been someone nearby to do
Right.
CPR, then he wouldn't arrive to someone who had already passed away. And just like, I just was so shocked. He like couldn't. He's like, I can't stress enough how much everyone needs to get CPR certified. And I put it on my calendar, and did I do it? No. I have not gotten CPR certified. No, I did not. I didn't do anything. So here, like, I wouldn't be. It's like I think I know, right? So
Well,
this would be
and
so
that's the thing.
powerful.
You may not need to get certified. If you have this thing
Hmm.
telling you exactly what to do, if you watch the video, it shows you like when the woman is trying to put the pads on and it's not quite in the right spot, and then it turns green as soon as she's in the right spot. And so it's really literally foolproof. I also think of what that would mean for, let's say you're in a car crash and someone is you need to help someone out. If you had those goggles and it would scan the environment for any dangerous things before you went in and helped that person.
This is where we're getting into like the sci-fi cool stuff
Right.
that I think about. It's just like, how can this stuff be good used for good?
Right.
Automatically, would there be something within the car, like kind of like the black box, where if the car has been totaled, it releases it. But we're out of time, Deepu. I could talk to you about cool tech and cool people and cool stories forever. I guess my last question for you is just: is there anything that you wish people listening to this podcast knew?
I think the one thing I would tell people is to always tinker, always be
Hmm.
curious about technology. It's not here to take away your job. In fact, it's there to enhance the skills that you already have. And so don't be afraid of it. Learn to embrace it because it is the future. And we really want highly skilled, highly technical human beings who can lead with the human touch.
Oh, couldn't have said it better. What a great way to end. Thank you for listening to Cool, Cool, Cool. I'm Cameron Kitt from Yo-Yo's. A huge thank you to Dipu Patel for joining us and sharing your magnificent story and all of this cool tech. And you can check out the show notes for a link to Dipu's LinkedIn and, of course, our website. And let us know what you thought of the episode on social media using the hashtag CoolCoolCool podcast. Dipu, thanks for coming on.
Thanks for having me, Cameron.